All right, this is my head to toe assessment video, my 360. Bella,
Hey,
Diane
studying.
she's studying. Diane's my patient. Juliana, nothing on the whiteboard, no extra people in here. Nothing on the TV. I mean, like, other than them. Okay, she knows what I mean. All right, so I'd walk in, wash my hands. While I'm washing my hands, I would say, hey, I'm Emily. I'll be your student nurse today. We're going to be performing a head to toe assessment. Okay, dry my hands, gather my supplies. Okay, and while I'm putting my gloves on, I would just kind of observe my patient. How you doing today?
Good.
Good. Any questions you have about what we're about to do?
No.
Okay. All right, can you tell me your name and date of birth?
Diane Colby, December 6, 2002.
Okay. Can you tell me where we are?
The Spring Hill Library.
All right. Do you know what year we're in?
2024.
Okay. So my patient is alert and oriented times 4. All right. So now I would do vitals. So I would get her blood pressure, temperature, respiratory rate, O2 sat, and heart rate. And are you in any pain today?
No.
Okay. So rate your pain on a scale of 0 to 10. 0 being no pain at all.
0.
Okay, perfect. All right. So my patient looks comfortable. She has good posture. She looks appropriate for her age and race. She seems to be in a good mood. She has no problems communicating. She's being very cooperative. No aphasia, no slurs while she's speaking. And yeah. All right. So now I'm gonna start with the neuro assessment. So I'm gonna grab this. And for this, could you close your eyes for me? And when I touch you, could you tell me where and if it's a dull or sharp sensation?
It's dull and it's the left upper shoulder. All right, it's gonna be on the right side, sharp pain, upper arm.
All right.
All right, it's gonna be on the left side, sharp pain, and upper thigh.
Okay.
The right side, sharp pain, upper thigh. Left foot, and it is sharp pain. Right foot, short pain.
Good job. You can open your eyes now. All right. And now I'm gonna get you to stand up for me, please. Okay. And could you walk in a straight line? All right. Turn around and come back, please. All right. Good job. Good job. And now I would test for her reflexes, but I don't have the tools to do that. So in a clinical setting, I would do her reflexes. Okay, now we're gonna assess her skin. So I'm just gonna look at you. Okay. Skin is dry and warm. She does have a scar on her right leg, on her upper thigh. Let's see. She has one tattoo. Yeah. Okay. Alright, so her skin looks good. I need to test for skin turgor, so I'm just gonna pinch you a little bit on your chest. Okay. Skin turgor is good. Skin is appropriate color for race. And yeah. Okay. No lesions or lumps or bumps or anything like that. Okay. Alright, now I'm gonna assess your head and your face. So I'm just gonna look in your hair if you don't mind. She check your scalp. Here I'm looking for any bumps or lesions, or if she has any lice or anything like that on her head. Okay, no lice, no bumps, no lesions. Okay, and now I'm gonna inspect your face. I'm just gonna put your hair underneath you. Sorry. Okay, so face is, everything looks symmetrical. Okay, no swelling. We're gonna assess her sinuses. So no swelling there. No lesions or bruises or anything like that. Okay, now I'm gonna look at your ears. And in a clinical setting, I'll have an otoscope that I would pull her ear up and back and assess the tympanic membrane, but I don't have that with me today. But the tympanic membrane should be white and pearly. And will you let me know if you feel any tenderness or pain?
No pain.
Okay. Do the same thing on this side. Nothing?
No pain.
Good job. Alright, her external ear looks good, no lesions or anything. And now we're gonna move on to her eyes. Get my pen right. Okay, could you look straight ahead for me? Just gonna shine the light in your eyes. Okay. Same thing on this side. Alright, so pupils are equally round and reactive to light. And now would you follow the pin light for me and not move your head? Alright, good job. And one more test. So follow the light with your eyes. Okay. So her eyes are reactive to accommodation. No shaking or movement of the head with that. So now I'm going to assess your nose. So would you look up for me? Okay. No deviated septum. No lesions in the nose. Everything looks good. Okay, could you open your mouth for me? Okay. Everything looks good. Her tongue is moist. Her oral mucosa seems good. Could I look under your tongue, please? Okay. Could you smile for me? With your teeth? You got pretty teeth. Okay, now gonna open my tongue closer. Okay, now I'm gonna be looking at her uvula and make sure there's not any swelling or anything like that in the back of her throat. Okay, stick out your tongue. Say okay? Sorry. No, you're good. Okay, so her uvula is midline and there was no swelling in the back of the throat. Okay. Alright, now I'm gonna assess your jaw. So when I press down, could you open your mouth wide for me? Okay. So no popping or anything like that, so she doesn't have TMJ. Right now I'm gonna move to your neck assessment. So I'm gonna begin by palpating your lymph nodes, making sure there's no swelling. No, you're good. I'm sorry. Okay. And could you move your neck side to side like this for me? Okay. Could you do it like this? Good job. And then back and forward. Good job. Okay. Now I'm going to auscultate her thyroid to make sure there's not any bruits, which would indicate an enlarged thyroid. So no bruits, so no enlarged thyroid. All right. And could you turn your head like that for me? I'm gonna assess for jugular vein distension. So no JVD noted. Now, okay. Now I'm gonna go ahead and do your respiratory assessment. Okay. Make sure my stethoscope's not cold. Okay. And for this, whenever I touch you, would you take a deep breath for me? Okay. Okay. All right, sounds good. And now would you turn around for me so I can listen to it every back? All right, same thing here. Whenever I touch you, just take a deep breath. All right, 2 more. Last one. All right, good job. You turn back around for me. Okay, now we're gonna do the 99 test. So whenever I put my hands on you, would you say 99? What numbers you say?
99.
Do it one more time.
99.
I'm sorry, but could you turn back around? Alright, same thing.
99.
One more time.
99.
Okay. Now we're gonna check for chest expansion, so while you're turned around, I'm gonna get you to take a deep breath for me. Okay, one more time. Okay, turn back around for me. You're doing great. Sorry, I keep making you move. Okay, so, one more time. Right, last time. Right, good job. So her chest expansion is good. My hands moved every time she breathed in, so it's a good sign. Okay, now I'm going to assess your abdomen. So could you, actually I'm gonna do your heart real quick, never mind. Okay. Alright, so I'm gonna be checking her heartbeat. Okay, I'm gonna start with the aortic valve. Okay, moving on to pulmonic. Okay, now Erb's point. Okay, now I'm gonna lift this up just a little bit. Moving on to tricuspid. Okay, and now the mitral. Alright, sounds good. Now I'm gonna assess your pulses. So her heart rate sounded good. Okay, now I'm gonna assess her pulses. So we're gonna start with the carotid, and I can't do that at the same time because she would pass out. So we're gonna do that one at a time. Okay, now we're gonna assess the brachial. So would you hold your arms like that for me? Okay. All right, now we're gonna assess her radial pulses. All right, Now we're gonna assess her popliteal pulses, so behind her knees. Okay. And now I'm gonna move to her feet and assess her dorsalis pedal pulses. Okay, so at the top of her feet. Yeah, there we go.
Sorry.
It's okay. Okay, strong pulses. Now we're gonna move to her posterior tibial pulses. All right, sounds good. All of her pulses were strong and 2+, and they were all present. Okay, now we're gonna move on to the abdomen part of the assessment. At this point, I would change my gloves, because I just touched her feet, but I don't have another pair of gloves, so I'm just gonna leave these on. She said she didn't care.
I didn't get, I don't get.
Okay, and would you lay down for me, please?
Sorry.
Okay. All right, now I'm gonna auscultate her abdomen. I'm gonna move to the other side of the table so you can see me. All right, we're gonna start with auscultation in the lower right quadrant. Okay. And here I'm checking to see if our vowel sounds are active and making sure they're not hyperactive or hypoactive. Okay, moving to the upper right quadrant. Okay, moving to the upper left quadrant. Sorry.
Sorry.
All right. So vowel sounds were active and or present and active in all 4 quadrants, not hyperactive or hypoactive. Okay, so now I'm gonna palpate the abdomen. So let me know if you feel any pain or tenderness. Okay. Okay. And now, while we're right here, I'm going to go ahead and percuss her liver and her spleen. Palpate and percuss. Do you feel any pain?
No.
Okay. And the spleen. You feel any pain?
No.
Okay. You ticklish.
Yeah.
Okay, now I'm going to percuss. Wait. Okay. All right. And you can go ahead and sit up for me. Back. Could you turn?
Oh, yeah.
I'm so sorry.
No, you didn't.
I think this is the last time you have to turn. Okay, so now I'm going to be percussing her kidneys to make sure there's no pain or swelling there. Any pain?
No.
Any pain?
No.
Okay, perfect. All right. Let's see. Okay, could you stand up for me, please?
Yes.
We're almost done. Okay, so we're gonna do the Romberg test. So, could you stand here with your arms by your side and close your eyes? Okay, just keep standing there. Do you feel dizzy or anything when you close your eyes? Okay. done. Alright, good job. Okay, and while you're standing up, could I have you bend over just a little bit so I can see your spine? Good, perfect. Just gonna make sure it's aligned. Okay. So her spine is midline and all the notches were palpable. So yeah. Okay, I forgot to do the whisper test for the hearing, so I'm gonna do that now. Okay, so could you close your right ear with your finger? Okay, and I'm gonna whisper something to you and repeat it back to me.
27, 28,
Okay, good job. Okay, could you cover your left ear?
36, 37.
Okay, good job. Alright, okay, and lastly, I'm gonna ask her a couple of questions about her GI and bowel and GU. Okay. When was your last bowel movement? Sorry.
Like an hour ago.
Okay. Okay. Was it normal color, normal consistency? Okay.
Yes.
Okay, do you ever have any trouble with constipation or anything like that?
No.
Okay. Do you have any urinary problems
No.
that you know of? Okay. Alright. And I would assess her cranial nerves during the neuro part of the assessment, but I don't have the tools to do that, so I would assess her olfactory, optic, ocular, motor, trochlear, trigeminal. I can't remember the rest of them. Sorry. Okay, is there anything else you need before I leave? Alright, then I will take my gloves off, wash my hands. Wash my hands. Make sure she has everything she needs, her call light, the bed's in the lowest position possible. Make sure she has her personal belongings. And then I would walk out, and I'm gonna do my 360 again. Nothing's changed, nothing on the whiteboard, nothing on the TV. Thank you, Diane, for being my patient.
You're welcome.
Thanks, guys, for sitting in.
Here.
Bye.